Hello, my name is Vi Thomas, member of the San Jose Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Our International Awareness and Involvement Committee has a special message for you. We urge you to share this information with others in support of World AIDS Day.
Hello, I'm Deborah Hicks, Chairperson of International Awareness and Involvement Committee. The International Awareness and Involvement Committee embraced World AIDS Day, December the 1st, as an international day of raising awareness and showing support for those living with HIV and AIDS and mourning those who have died from the disease. We are pleased that we are able to make a contribution to children orphaned by HIV and AIDS residing at the Delta House known as the Vashi Village, located in Swaziland. We will continue our endeavor to increase HIV and AIDS awareness and its serious impact that it has on our public health. Thank you.
What is HIV? HIV is human immunodeficiency virus. It is a virus that attacks the body that help to fight infection and diseases, making a person more susceptible to other infections and diseases. It is usually spread by contact through bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. There is no cure, but it is treatable.
If left untreated, HIV can lead to AIDS, which is a late stage of infection. AIDS stands for Acquired Immune Deficiency Syndrome. A person can live many years with HIV in his or her system without experiencing any symptoms. But when enough T cells have been destroyed to severely compromise the body's ability to fight infection and disease, a person's diagnosis progresses to AIDS.
Many people with HIV do not experience any symptoms until late in the progression. In fact, the virus can live in your body for 10 years or more without causing any obvious symptoms. Not everyone will have the same ones. It depends on the person and what stage of the disease they are in. Early in the infection, about 2/3 of people will have flu-like symptoms, which we know are common with many viruses. The only way to be certain of your status is to get tested.
Hello, I am Loretta Strom, and I am a member of International Awareness and Involvement. This red ribbon represents support of people living with HIV and in remembrance of those who have died from AIDS.
Testing is relatively simple. You can ask your healthcare provider for an HIV test. Medical clinics, substance abuse programs, and community clinics also offer tests. You can also purchase a home test kit online or at your local pharmacy.
HIV continues to have a disproportionate impact on certain marginalized populations, particularly among racial and ethnic minorities. As an example of the disproportionate impact of HIV in 2018, there were more than 1 million people in the US living with HIV. African Americans accounted for 42% of new cases, but only 12% of the population. Latinx accounted for 27% of new cases, but only 18% of the population. Certain subgroups within racial and ethnic minorities are affected as well, such as our LGBTQ community.
This year, COVID-19 has not only forced an adapted response to HIV/AIDS in marginalized communities to ensure continuity of services, but also it's reinforced the urgency of ending the HIV/AIDS epidemic in the US and around the world.
If you test negative, you can use HIV prevention tools to reduce risk of getting HIV in the future. If you test positive, you can start HIV treatment to stay healthy and prevent transmitting HIV to others. If diagnosed early, antiretroviral therapy can keep HIV under control, and many go on to live a normal lifespan. Reach out to your healthcare provider to discuss your options. If you don't have a healthcare provider, you can go to hiv.gov for information on locating one.
I wear the red ribbon in support of people living with HIV and in remembrance of those who have died from AIDS.
Delta Sigma Theta Sorority Incorporated joins in global solidarity with people around the world to unite in the fight against HIV, show support for those living with HIV, and to commemorate those who have died from AIDS-related illness. Our theme this year is Rock the Ribbon. Please join us in the fight by sharing these facts and tips with your friends, loved ones, and social network. Together, we can end the stigma associated with the disease and arm the community with vital information to keep themselves safe.